Have you ever heard of the term doula? What is that? Is that Greek? Is that even a real word? I'm here to tell you that the word doula may be one of the most important words that you will want to familiarize yourself with if you are expecting a baby or expect to have a baby in the future. Hi, my name is Bridget Kahn, and I'm here to inform you on how a doula can change your life. So what is a doula anyway? The term doula is a Greek term and which means woman who serves. So get this, if you or your significant other are expecting a child or are planning on having a child in the future, listen up, a doula is here to serve you. So number one, what is a doula? What is their purpose? A doula is trained in childbirth to provide physical, emotional, and educational support. A doula will meet with you a couple times prior to getting to know the two of you, beginning before labor and delivery, so that you can become familiar with each other. This is a time for questions and to start a birth plan. Also, the doula will never leave the mother's side during labor and delivery. This allows the significant other to grab a quick bite, grab some coffee if it's a long labor, or hit the refresh button. Also, a doula is trained in relaxation techniques and ways to have a natural birth to help with pain relief. And these include some of the items that we'll go over here in a little bit. Include counter pressure, relieving hip pain, lower back pain, and possibly even hot water or cold water for water therapy. So number two, why do I need a doula? So they're not here to take the place of a midwife or a doctor, and definitely not the place of your significant other. The doula is here to answer questions and to spend time to get to know you. Also, having a doula can significantly decrease the use of pain relief medications, which is less likely to need interventions as you move into labor and delivery, which equals a much more positive birthing experience for the mother and the baby. Looking back, the mother is likely to look back on the birthing experience and feel positive and feel good about the experience that they had. Evidence-based birth tells us that women who were continuously supported during labor and delivery by a doula had a 31% decrease in the use of Pitocin, which is a drug used to initiate or progress labor. Also, they had a 28% decrease in the risk of cesarean, a 9% decrease in the use of any pain relief medications, and a 34% decrease in the risk of looking back on labor and delivery and being dissatisfied with the birthing experience. Can you imagine looking back on your birthing experience and feel that you didn't think things went the way that you thought they would? Number three, there are many benefits to having a doula with the laboring mother. Statistics show that the outcomes are much better when a doula is present to be able to provide continuous support to the laboring mother. Having a doula helps prepare the expecting mother and fathers for childbirth and help answer any pregnancy and delivery questions. Having the birthing plan is also an important piece, and it helps ease any questions or tensions that the mother may have upon going into the hospital, birthing center, or home birth setting. When in the labor setting, the doula can help the mother focus on the birth plan and stick with the decisions that were made ahead of time. Perhaps breastfeeding is something that the mother wants to do. The doula can help initiate breastfeeding, which can help breastfeeding be a success. Also, delayed cord clamping. Delaying cord clamping 2 to 3 minutes after the baby is born helps the placenta deliver the blood back to the baby, making it essential for the baby to be alert and be able to bond with the mother. Also, maybe the birth plan, the mother has chosen to do skin to skin. This allows for the baby directly after birth to be put onto the mother's chest, allowing the bonding process to begin. Also, doulas can help decrease the length of labor with the help of positioning techniques. So I'm going to show you a couple of those. The first one is called the rebozo, and this is simply just a thick piece of cloth. I'm just using a blanket This is used around the hips of the mother, and this is one of the techniques, since that this chair is too tall, but the mother would place their feet flat on the floor and then press their back directly against the chair. They would sit here comfortably and relaxed, and the doula would stand opposite of the mother and pull on the rebozo. So what this does, it releases the tension in the lower back, in the hips, and allows for some of the pain relief during the contractions. Also, counter pressure can also be applied for hip pain or lower back pain. And what this can do, the mother can either bend over on a chair or press up against a wall, or perhaps even lean against a birthing ball. But the mother would lean against it, take some of the weight off, and the doula would stand behind and press against the hips to relieve some of the pressure. Also, one that is popular for pregnant mothers is to sit on a birthing ball. And what you can do is either roll back and forth, or go around and around, or bounce. And this helps spread the pelvis to allow the hips to spread, and helps alleviate some pain, but it also spreads the pelvis to allow the baby to get into position. So this helps for during delivery or during labor, as well as if you're able to during closer to delivery as well, if you're able to move around. This is also helpful for something firm. If you have received an epidural, you can lay on your side if possible, and then put this between your legs to spread the pelvis to allow for your pelvis to be open. So this can help as well, something firm to open your legs. So if you are expecting or planning a baby in the future, look up a doula. You'll be glad you did. Thank you.